I'm Dr. Mitzi Joi Williams. I'm a board-certified neurologist and multiple sclerosis specialist. My mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. I also foster collaborations between patients, advocacy groups, and other organizations to increase diversity in clinical research. I'm going to talk a little bit about what you can do to improve your health with MS. When people are diagnosed with multiple sclerosis, it can be devastating. Depending on the level of disability, it can affect family relationships, it can affect their careers, and it can affect their trajectory of their lives or what they thought that their lives would look like. And one of the most common questions that I get at that first visit for diagnosis or for treatment options is, Dr. Williams, what can I do to improve my health? Certainly there are medications that are used to help treat certain symptoms, but in our society there's an increasing awareness of natural remedies, alternative medicine, and other ways that you can improve your health besides taking medications, because nobody wants to take a medication that they don't have to take. So 3 things that you can do to improve your health with multiple sclerosis are: number 1, stop smoking. If you're smoking cessation is one of the most important things you can do to improve your health and also decrease your risk of progression to secondary progressive MS. Smoking has not only been linked to increased risk for MS in those who are active smokers as well as some of their family members, but it's also been linked to a faster progression to secondary progressive MS. For those who are diagnosed with relapsing remitting MS, which is the most common type of MS, about half of those folks are thought to go on to develop secondary progressive disease. And if you smoke, it actually increases your risk for becoming secondary progressive much faster than if you don't. Another reason that it's important to stop smoking is that it's linked to many other health conditions such as emphysema, COPD, some forms of lung cancer, as well as many other health conditions. Smoking cessation is important not just for your general health, but also to improve your life living with MS. What's another thing that you can do to improve your health naturally with MS? Exercise. Exercise is so important for a variety of reasons. Number 1, it helps with your cardiovascular function, can help decrease the risk for things like hypertension and diabetes. Also, if you want to lose a couple pounds, it certainly helps to do that. Exercise is also important because it can improve some of the symptoms of MS. For instance, spasticity, which is tightness that can be in the arms or the legs. Sometimes it's worse at the end of the day. Sometimes spasticity can manifest itself as kicking or involuntary movements of the extremities. This symptom can be improved with exercise because stretching exercises such as yoga will help stretch those muscles out to help improve that symptom so that when you lay in the bed at night, the pain is not keeping you up at night. Also can help you improve throughout the day so that you can do more and function optimally. Another symptom that is improved with exercise is constipation. A lot of my patients are stopped up. And so if you exercise, it helps get everything moving so that you can go to the restroom more regularly. And finally, fatigue is a very common symptom that many people with MS suffer from. It can often be so disabling that people actually have to leave the workforce. How can exercise help fatigue, you say? Because many of my patients say, Dr. Williams, I'm too tired to exercise. Even though you may be too tired to exercise, just doing a little bit of increased activity can help improve your level of energy. So if you've ever at any point in your life gone on a fast run or done some type of exercise or dance class, you know that at the end of that class, you get a burst of energy and you're able to do a little bit more. One of the most important things to do with MS and exercise is sometimes we have to reframe our thinking about exercise. Exercise does not have to be you going to the gym with your spandex outfit on and pumping iron for an hour. Sometimes doing just little things and increasing your activity just slightly throughout the day can give you some of that benefit and help improve some of those symptoms. So the 3 things that you can do to help combat or improve your life with MS are: stop smoking if you're smoking. Also, you can exercise. And then finally, eat a healthy, well-balanced diet. Many people ask me if there's a particular diet that everybody with MS should eat. And there really isn't one. And honestly, there's a lot of research that needs to be done in this area. However, we know that if you eat a healthy, well-balanced diet, eating more fresh foods, less processed foods, that it can not only improve your overall health, but also improve some of your symptoms with MS. For instance, fatigue is a very common symptom that we just discussed, and many people are fatigued depending on what they eat. So if you eat a nice healthy salad, you may feel energized and ready to go, versus eating Thanksgiving or Christmas dinner with lots of carbohydrates and other foods in it. You may actually want to go lay down and sleep, right? So you know the difference that your body feels depending on what you eat. So it's important to eat that healthy, well-balanced diet so that you can feel better and be able to do more in your overall life. There's a lot of research looking at diet and also looking at the things that we intake related to MS. There have been some recent studies that suggest that obesity can be linked to increased risk for MS, and also if people are obese, it actually can worsen the course of MS. So it's important to eat a healthy, well-balanced diet to decrease the risk of obesity in combination with exercise. Another interesting topic that is being looked at with diet is the gut microbiome. And what is that, you might ask? There are all kinds of organisms and bacteria that kind of hang out in our guts. And what we're learning is that the gut microbiome, or all of those organisms, actually educate our immune system. So there are a lot of scientists that are looking to see if the things that we put in our body will actually lead our gut to tell our immune systems to cause MS, right? Which is overactivity of the immune system. There's still a lot of work that needs to be done in that area, but it's certainly something that is being looked at more closely, and every day we're finding new discoveries to help us to understand more about how diet and the things that we take into our body may actually affect MS. So the 3 things that you can do: stop smoking, exercise, and eat a healthy, well-balanced diet so that you can be your best with MS.